Hello, everyone. We'll get started in a moment. Just giving everyone a chance to join the webinar. Hello, and welcome to our Washington Days 2019 webinar. This webinar is being recorded for those who cannot attend. Once we have finished recording, conducting the webinar, we'll post the recording on NHF's website, and this way you can have your family view it or anyone you choose to share it with. This webinar is all attendees are in listen only, so you will have to use the Q&A tab on the bottom of your Zoom screen to ask your questions. And with that, I'd like to introduce myself. My name is Marla Feinstein, and I'm with NHF. I am joined by my other co-speakers, which I have to press. Joanna Gray, who is NHF's Federal Policy Advisor, Nathan Schaefer, who is NHF's Senior Policy Director, and Beth Marshall, the Director of Communications. And with that, I turn it over to Nathan.
Welcome everyone. We're really excited that you're able to join us this morning. We know that for many of you, this may be your first time to Washington Days or maybe your second time. So we know a lot of you are going to be embracing new opportunities, and we're really excited to welcome you to Washington on March 27th. Keep in mind also that there are about 100 new members of Congress. So for many of them, this is going to be the first opportunity that they will be interacting with a constituent from their district that is living with a bleeding disorder, either themselves or within their family. So we don't mean to put pressure on anyone, and we're going to spend a lot of time today, and also once we are convened in Washington, giving you all of the preparation that you might require. But we're really excited to have a new Congress and many new participants this year. So what we're going to cover today is what to expect and what to prepare. There are a number of things that you can do in advance of your travel to Washington to ensure that your meetings are going to have the most impact possible. So let's start with how does the event work? So you'll arrive on Wednesday morning and you'll be able to check into your hotel in advance of when you register and when the trainings commence. The trainings commence at 4 p.m. and they will go until 6:45, and then dinner is afterwards. Included in the training, the trainings start at 4:30. And by the way, don't feel like you have to take copious notes right now. You're going to get a reminder email the weekend before you travel to Washington Days that will have all of these times, locations, everything you need to know. So don't feel like you have to memorize everything on the webinar today. But during the training on Wednesday afternoon, you'll have an overview of best practices by way of social media and how to engage with your elected officials on different platforms. You'll hear more about that in a little bit on the webinar, but that will be part of the training on Wednesday. You'll also get a brief of everything that's going on in Washington, what the political climate looks like, and what our issues and priorities are, which you're going to hear more about from Joanna in a few minutes. But what we want to stress is on Wednesday, you're going to receive all of the training that you need. You also will be given ample time to convene with the other people from your state that you will then travel up to the Hill with on Thursday. And Thursday morning begins with a final training and issue briefing after breakfast. We also will be welcomed by a member of Congress who we were already talking about new opportunities and new relationships. He is a new member of Congress from upstate New York who's going to be welcoming folks and stressing the importance of what it's like to tell your story. Then you go up to the Hill and you will have a schedule that we will have prearranged for you. All you have to do is follow it. And keep in mind, sometimes your visits are close in time to one another, so you do have to be very mindful of how much time you're spending in each of the meetings, which we'll talk more about that in advance. And you have lunch on your own up on the Hill. We will provide you with a map that includes where are the best cafeterias to go to. My personal preference is Longworth on the house side, but really you can't go wrong.
I'm a big fan of the Senate side.
You can't go wrong. There's lots of opportunities for good coffee, good salad bars. You'll definitely be able to get some sustenance. And like I said, you just need to follow your schedule throughout Thursday, which will all of your Hill visits. And we'll talk more about what to expect with that, because again, you're not going to be going on your own. You're going to be going on a team. After the conclusion of your meetings, you'll come back to the hotel Thursday afternoon. We will have a post-appointment check-in where you will be able to come back and share your evaluation forms and share any particularly highs or lows from your experience throughout the day. Then we will feed you dinner and we will have a brief program highlighting some success of our advocacy efforts at the state level. Also hear from some NYLI representatives, but I promise you the Thursday evening programming will be brief because we know folks have a very long day on Thursday and they're very tired. So it will be celebratory, but it will also be concise.
And for those new attendees who don't know what NYLI is, NYLI is our National Youth Leadership Institute.
Then the final day of Washington Days is Friday morning, where you will have training about state level opportunities. And you will also get to hear more about what's on the slide here with My BDC, which is a groundbreaking initiative of our research department. You'll get an overview of what the project entails and what opportunities are associated with it on Friday morning, and there will be a table set up where you'll be able to interact directly with staff from the research department to answer any questions and figure out how you might be able to be plugged into this opportunity. The final thing I'll say about Friday morning, the training begins at 8:30 a.m. We promise you it will end by noon. After 3 days of a lot of training and a lot of walking around the Hill, we know folks are going to be tired. We assure you the programming will all be complete by noon on that day.
And just another note, Maria Santayana and Michelle Woodcock from NHS Research Department are the people in charge of My BDC, and they will also be on site to, should you have any questions before.
Hey guys, this is Joanna. I'm just going to pipe up to say that the last part when Marla was talking was kind of coming in and out. So I'm not sure, Marla, if you want to scoot to where Nathan's talking and repeat what you just said, or if you just want to try again, maybe it was just the webinar for just a sec.
Oh, I was just saying that Maria Santayana and Michelle Woodcock from NHS Research Department, and they're the group that's leading the My BDC. They will be on site the entire duration of Washington Days. They will also have a table set up, so you'll have a couple of opportunities to ask them additional questions should you have them prior to Friday.
That sounded great. Thanks.
So the other thing that we wanted to stress is we promise you will be adequately prepared. In addition to the webinars today, like I said, you are going to receive a follow-up email with all of the information you need to know to prepare for success, but you'll definitely have time on site to assemble with other members of your team and practice what you want to say when you go up on the Hill. We really encourage you to practice with your team in advance. It's not uncommon for folks to think that they've got a good game plan going into their first visit, and if they haven't actually prepared in terms of who's going to say what and in what order you will speak, that people can fumble over one another until they eventually get into a decent rhythm. But the more that you can practice in advance, the better. We also will be providing you with leave behind materials. You're not going to be asked to memorize every single one of the talking points or issue priorities. There will be documents that you can leave with your member of Congress and or their staff. We also will be providing you with personalized contact business cards, so that in the event that anyone that you met with wants to ask you a follow-up question, they can be in touch with you. And by the way, we'll talk about plans for follow-up, which we will primarily manage on behalf of all of the attendees. So we promise you will be very well prepared. You also will never be alone. If you've never gone up to the Hill before, we promise you, you will not go up by yourself. You will be in teams with other members from your state, probably from your region if you're from a densely populated state. In the event that you are the only attendee from your state, you will be paired with someone else from a neighboring or nearby state. You don't necessarily have to be a resident within the state with which you're meeting to have a considerable impact. But we will put you in teams. Wednesday night, you'll get to know your team members, many of whom you probably already know, but you'll definitely have time to get together with your team members and be able to have a joint experience when you go up on the Hill. The next point that we wanted to make is that many folks that haven't been to Washington Days can sometimes be disappointed if they don't meet with their member of Congress or their senator directly. And we are here to tell you that that is not uncommon. We do our best to try and schedule meetings directly with the members themselves, but they have very, very demanding schedules. And the reality is that staff members actually do most of the legwork behind the scenes. If a member has agreed to co-sponsor a piece of legislation, for instance, it is the staff member that actually submits the paperwork. Congressional staff members have expertise in a number of respective fields. Members of Congress will have a staff member that deals with healthcare, and a separate one that deals with transportation, and a separate one that deals with energy, for instance. There's no one size fits all. Each office is a little bit different. But the point that we want to make is don't be disappointed if you're meeting with staff members. Frankly, in many ways, it's preferable because they know more about healthcare and our issues than their bosses usually do. Don't tell them I said that, but that's the reality. They are experts within their field, and they can be very powerful and effective advocates. And also, they can be very young. The folks that take on these roles do it for experience. So they're usually early on in their career, but that does not mean they are not very, very smart and dedicated people. But don't be surprised if you meet with a staff member and they are very young. It's not uncommon. Keep in mind that you are there in Washington to share your family story. You're not there to be an expert in healthcare. You're not there to be an expert in how a bill becomes a law or how various congressional offices interact with one another or how committees deliberate or any of that. You are there to share your family story because only you know the reality of what it's like to live with a bleeding disorder in the district where you live, and you're there to tell your member of Congress what it's like. So don't feel like you have to be an expert in anything beyond your story. Keep in mind, kids are fabulous storytellers. I've seen young boys who just show their port, and that can have a very meaningful impact about the complexity of what it's like to treat a bleeding disorder. For bleeding disorder management, you have to get medication into a child's vein. That's a very different experience than many other conditions. So children can be incredibly powerful storytellers, even if they don't say very much at all. And also, when we don them all in a red tie, they're just really stinking cute. So they're great for photo opportunities as well. And I know that that could include taking your child out of school, but I've heard of many families whose teachers have been very encouraging about the opportunity for young people to go and interact with an elected official. It can be a very educational experience. So keep in mind, your kids are great storytellers, but one caveat, we do not provide childcare. So you are encouraged to bring your children, but you are going to be responsible for them for the duration of Washington Day's experiences. So things you can bring along with you, sort of props, if you will. One of the things that we always try to convey is just how expensive it is to treat a bleeding disorder. So if you have a copy of an insurance bill or an explanation of benefits that is a monthly bill or a quarterly bill or an annual bill, please bring that along. And if you don't have it, but you know the figure, please be prepared to share that as well. Photos. Photos can say 1,000 words. So we encourage you to think about a photo that tells the story of a particularly difficult bleeding episode or a milestone. For example, many families have brought a photo of the first time that their child learned to infuse. And many times they learn to infuse at summer camp, which again conveys a lot about the complexity of living with a bleeding disorder and what it's like to unite with other community members. So think about any kind of photos that tell a story, but I would caution you not to bring too many photos because these meetings do take place very quickly, which we'll talk more about as well. So think about maybe 3 photos that tell a particularly meaningful part of your story. And think about bringing factor, either expired factor or a demonstration kit, anything that can explain what you have to prepare in order to administer your medication and what that cost. I've seen many families say, this is my vial of medication. I'm required to take this every other day, and each of these doses cost about $2,500. That can tell a very important part of our story about how expensive it is to care for bleeding disorders. So those are some things to think about bringing along. I am now going to turn it over to Beth Marshall, our communications director. But keep in mind, if you have questions, you can put them in the Q&A portion at the bottom of your screen.
Hi. So it's important when you're in Washington, go to Washington Days to make a good impression. The dress code in Washington, D.C. is business dress. You will be more comfortable if you are dressed more professionally, and in general, people will listen to, are more likely to listen to your message and take you seriously. You do not have to wear a suit. If you want to, you can, and you'll fit right in. But if you don't have one, don't worry about it. However, I would strongly encourage for men wearing a button-down shirt and either black or khaki pants. You can wear a sweater or a sport coat over the button-down shirt because who knows what the weather's going to be like. For women, you can wear a casual but comfortable dress or nice pants and a skirt and a top. I would avoid anything that is too short or too low cut. Washington dress tends to the conservative. So I would just keep that in mind. For your kids, obviously it's looser, and it depends on the age of the child and kind of what you can get them to wear. I would say school picture clothes maybe is a good baseline. And, you know, jeans are totally fine for kids, and, you know, a nice shirt. And, you know, so I would just use your best judgment. It really depends on what you want your child to be comfortable. It is also Bleeding Disorders Awareness Month, which means that it is time to wear your red tie. If you don't have a red tie, we will provide one for you at registration. If you happen to have a red tie that you've gotten maybe from one of your state advocacy days or a previous Washington Days, please bring it. We're kind of running low on red ties in general. So if you have one from a previous advocacy event and could bring it, it would really help us out. But like I said, if you don't have a tie, you can get one at registration. We will have ties for the kids too. We don't have any non-tie options for women available, unfortunately. So if you,
Beth,
yeah,
I'm
I
going
don't know.
to sorry, this is Joanna again. Just to say that you're kind of coming in and out again.
Is this any better?
Yes.
Okay.
Yeah, go ahead. Sorry.
Okay. We don't have any non-tie options for women available. So if you don't want to wear a tie and you have a red scarf, go right ahead. I cannot stress this enough. Wear comfortable shoes. There is a tremendous amount of walking. Most of it is on pavement or marble. It is very unforgiving on your feet and your joints. Don't wear high heels. For men, those dress shoes with the very thin soles, I don't really recommend those either. Find some cushioned flats, some low-heeled shoes, some gel inserts. But please remember, you're going to be on your feet for a lot of the day, and although elegant, it is somewhat unforgiving terrain. We do have scooters available. Hopefully, you will be registered for a scooter if you need one. We do recommend that you charge your scooters between meetings if possible, and be sure to remember to bring your scooter back to the hotel.
Another thing about footwear that I have seen in the past, it's totally okay if you want to have a nicer pair of shoes, but you don't want to walk around all day in them, just to carry them in your purse or your handbag and change into them once you get to your meetings. And keep in mind, when you're going from building to building to get to your various meetings, you do have to go through security each time. So keep that in mind in terms of how much stuff you want to carry with you up onto the hill, because you do have to take it out and go through metal detectors. They aren't as stringent as the metal detectors at airports, for example, but just keep that in mind.
Social media. So part of the fun of Washington Days is engaging with your representatives on social media. We really do encourage everyone to interact with their legislators in a positive way on social media during Washington Days. We are going to make this very easy for you to do. You will be given the Twitter and Instagram handle of your reps if they have them, and most of them do. We encourage that on social media to thank your reps for meeting with you and to remind them. I'm sorry, I know we're having a problem with the audio right now. We encourage you to thank your reps for meeting with you and to remind them of the issues that we're talking about. It's another reinforcement of our messaging for the day. We do encourage everyone to take pictures with the reps or staffers for social media purposes. Of course, I would ask permission first. Some of the aides don't like to be photographed, but the majority of your representatives will be accommodating. From the NHF accounts, we'll be watching and cheering along all of you from our own social accounts. So if you use our Washington Days hashtag, which is hashtag NHFWD, we can retweet and comment and help keep the momentum going. And you can also use our Red Tie campaign hashtag. And with that, I'm going to turn it over to Joanna to discuss the issues.
Great, thanks so much, guys. Good morning. I guess it's still morning for everybody. Thanks so much for joining us and for your willingness to come to Washington. As my colleague said, my name is Joanna Gray, and I am one of NHF's federal policy advisors in Washington, and I'm involved in putting all of Washington Days together, and I'm pleased to share a little bit with you this morning about what our policy issues are going to be. Let's see if I can. Oh, perfect. And I think I'm going to walk through these pretty quickly, but I think the most important thing for you to remember before I launch into all of this is what Nathan said a few moments ago, which is what we really are hoping all of you will do is share your own stories. Talk about your family, what it's like to live with a bleeding disorder, if you're a provider, what it's like to care for people with bleeding disorders and work at an HTC, for example. We try to connect personal stories to what's happening in Washington, and that's kind of where my job comes in. But I hope that no one feels daunted by the information that I'm about to share. It really is just to provide background. And again, we'll go over all of this in pretty great detail on the Wednesday evening training, so this is just to get you started. But in general, Washington Days 2019, we're going to be focusing on 2 issues. The first is educating members of Congress about bleeding disorders in general, and the handful of federal programs that particularly affect people with bleeding disorders. And we're going to talk about short-term insurance plans, which are inadequate and are kind of harming the insurance risk pools, and that we hope Congress will act to oppose them because they don't cover what we need. The thing about all of this is that, we just had an election in November, as I'm sure all of you are aware, and there are more than 100 new members of Congress, and there are dozens of new congressional staffers who came along with them. And pretty much every ad I saw anywhere last November from both parties talked about the need to protect access to insurance for people with pre-existing conditions. Everyone now agrees that that's something that's important, and we're going to be talking about some policy issues that affect that. And it's okay to say, Congressman or Senator so-and-so, I know I remember your ads. I know that you're supportive of protecting access for folks with pre-existing conditions. That's exactly what, all those issues exactly affect our community. So let me tell you specifically what I'd like for you to do to help protect us. So this is the kinds of issues we'll be talking about should be familiar to all the members and staff that you are meeting with. So don't feel like, again, you need to know all the policy details, because the folks you're meeting with will know them as well. So when we start meetings, we always start with Bleeding Disorders 101. And for those of you who came to Washington Days last year, you might remember we started the same way, but we encouraged you to kind of get through this quickly, kind of breeze through this so we can get to the meat of the policy stuff. And this year we're going to do it a little bit differently. We want you to spend plenty of time here, again, because there are so many new members of Congress and staff. So we encourage you to even start with the basics about what is hemophilia, what is VWD, what bleeding disorder affects your family, what does that mean to your daily life, how do you treat it, what are you worried about when it comes to access to insurance, have you had insurance troubles in the past, do you go to your local HTC, where is it, what happens when you go to your HTC, why is access to quality health insurance so important, and access to providers who are familiar with bleeding disorders, why is that so important? Our community really is a model, and so many of the policies that, again, Congress is interested in this year relating to insurance, relating to drug coverage, et cetera, all impacts us. And so we want them to kind of see us as a resource as Congress is working on policies this year. And again, because so many faces, encourage you to really start with the basics. I often say in meetings when we start, I'm here on behalf of the National Hemophilia Foundation. We want to talk to you about some issues affecting the bleeding disorders community. Are you familiar with a bleeding disorder? And often they say, oh yeah, I kind of know about that a little. I kind of know about that a little means they probably don't know anything at all. So if you get that response, you should feel free to really start at the basics. And even folks who say, oh yeah, I meet with you every year and I know everything, you may have new members of your team that the staffer hasn't met with before, and they can tell their personal story. We will have plenty of time this year for everyone to tell their story, and so really encourage you to do that. The other thing we hope you'll cover as part of the bleeding disorders background is there are 3 particular government agencies that are especially important to our interests. And I don't want us to get bogged down in exactly which funding level for which program. I think we can stay pretty high level. The written materials that you will have in your folders and that we'll have in the leave behind folders that you will leave behind with the staffers and members you meet with will have all of the details of funding levels and program names and all that stuff. So I think I'd encourage you to stay high level. But to just briefly walk through the three, the first is at the CDC, so the Centers for Disease Control and Prevention. And we care about the CDC because it provides funding for hemophilia treatment centers to do surveillance data collection and prevention research. There is funding for patient education and outreach programs. If you've ever interacted with the Steps for Living program that NHF does, for example, Handy, our information kind of program, has gotten support from the CDC in the past. I know that HFA also gets some support for patient outreach and education programs from the CDC as well. There's also a lab and research at the CDC itself. So a lot of the CDC, the first two things I talked about, that's where funding goes from CDC to other stakeholders, to HTCs and patient organizations. Some money also stays at CDC where they do research. They developed a new test for inhibitors, for example, that doesn't require washout. And that was something we were really excited about. The CDC program started in the 80s and 90s during the HIV crisis. And what has been so exciting about working with our partners at CDC is that they have kind of modified the program over the years to be responsive to what the next biggest concern is. And so now a lot of their work is focused on inhibitors while keeping the kind of blood safety is always at the core of what they do as well. The second agency is HRSA, and of course I'm from Washington, so I always have a million acronyms. And HRSA may be less familiar to folks. I think most folks have heard of the CDC. But HRSA stands for the Health Resources and Services Administration. Rolls right off the tongue, right? So HRSA has grant programs to improve healthcare for people who either live in rural areas or are economically or medically vulnerable. The HRSA programs are much more about delivery of healthcare services rather than surveillance and research at the CDC. So HRSA, that's where community health center programs are, rural healthcare center programs, family planning programs. But for us, there's also funding for HTCs to provide services not usually covered by insurance, such as the physical therapy assessment, case management, social work services. A lot of what we think of as a kind of HTC comprehensive care, integrated care network. A lot of those services can't really be billed to insurance, and so HRSA funds help to cover some of that staff time at the HTC. HRSA also administers the 340B drug discount program, which I suspect folks have heard of as well. HTCs are eligible to participate in that program because of being HRSA grantees, and it allows them to have pharmacy programs, which allows them to generate some program income to support the multidisciplinary comprehensive care provided to patients at the center. So for HRSA, we care both about the grant program and 340B. And then finally, we have the National Institutes of Health. NIH is our nation's medical research agency. They focus on funding biomedical research kind of in all areas of healthcare to try and improve health, save lives, and develop cures. What's exciting for us, and I probably should have said this at the outset, is that bleeding disorders are rare conditions. And it's exciting that because of sustained advocacy over the years, that there is a network of federal agencies really focused on our patient community. I can tell you that there are many, many groups, patient group communities who would be thrilled to have the amount of resources that we do. And when it comes to the NIH, what's exciting is that the folks at the National Heart, Lung, and Blood Institute, who are the head of all of the blood activities, both the director and the deputy director are former HTC directors. So at the kind of high, we joke we have friends in high places, but we really do. And I think because of those relationships and that expertise, NIH has also been doing some really exciting work that matters to us. One is they held a State of the Science meeting last year, and soon we'll put out a report about developing a research agenda to prevent and eradicate inhibitors. And they supported genetic testing for some of the My Life, Our Future participants. Some of you may have participated in that program as well. One note, if you kind of get into the details of the fact sheets when we give them to you in a couple weeks, when it comes to NIH, groups don't support, there isn't a specific hemophilia line in the NIH budget the way there is at CDC and HRSA. All groups support the overall NIH funding number, and the goal there is you think a rising tide lifts all boats. If NIH has more funding overall, then that will lead to more funding for each of our, in each of our particular areas. So at the end of your kind of Bleeding Disorders 101 and talking about these federal programs, our ask for Congress is to support the federal programs at these agencies that benefit our community. And we know that they're really important to ensuring HTCs continue and that there's research and data collection to improve the health of our community, which we know is really important. So we hope, we've been lucky to have Congress support all these programs for many years, and we hope that that will continue. The second issue that we'll be talking about relates to access to comprehensive insurance. And before I get into the specifics of the short-term plans that we'll be talking about, I thought it'd be useful to just take a second to talk about some of the big picture patient protections included in the Affordable Care Act. A lot of these terms are thrown around a lot, not just in campaign ads. And I think it's worthwhile to just make sure we're all on the same page about exactly what they mean. So pre-existing condition protections are really two things. One is that plans have to offer you coverage, even if you have hemophilia, but they also can't charge you more based on your health status. So they can't charge you more for your premium based on having hemophilia than if you don't. The ban on lifetime and annual limits, this was something that we were kind of the lead advocate for back in 2009 and 2010 when the ACA was under debate. This is to prevent dollar limits on insurance coverage. So before then, plans had, say, $1 million. Once you hit $1 million worth of claims, that they would kick you off the plan. And plans aren't allowed to do that anymore, either for over the lifetime that you're on the plan or on a yearly basis. And that requires the essential health benefits, which are the set of services that plans have to cover that ensures that coverage is comprehensive. So before, people bought plans that they thought were comprehensive, and then it turned out maternity services weren't covered or prescription drugs weren't covered. Now plans have to cover these 10 broad categories of services, and it's also important because lifetime and annual limits are only banned for services within those 10 buckets. So anything that weakens the definition of the services then weakens the other protections as well. We know how important these patient protections are. We advocated for them back when the ACA was under debate, as I mentioned, and because these were threatened, that's why that we as a community advocated so strongly against ACA repeal efforts in 2017. And that may have been, these debates may have been what brought some of you to Washington for the first time or have you interested in coming this year. While Congress was not successful in repealing the ACA in 2017, the Trump administration has been very successful over the last few years in doing what it can under its discretion to give plans and states more flexibility to set rules. And in October 2017, President Trump signed an executive order that was specifically trying to promote choice and competition, and to promote 3 types of health insurance plans, which are listed here on your screen. And the picture here is of him signing this exact order, and you can see the folks behind him who are clapping are members of Congress who are supporting his efforts. And so there's 3 kinds of, basically, I have skinnier here in quotes because they are less comprehensive, less expensive. That's the goal, is to give people more options that don't cover as much to lower premium costs. And we're specifically going to be talking about short-term plans during Washington days. So short-term limited duration insurance, or short-term plans, offer stopgap coverage for people between jobs or other forms of coverage. You know, I bought a short-term plan years ago when I had graduated from college and my student insurance was ending, but I didn't have a job yet. And I was too old to be on my parents' insurance back then, and so I bought a 3-month short-term plan to cover me until I had access to coverage under my first job. So before, plans could only last 3 months and they could not be renewed. The idea was, because these plans are not comprehensive, that they really were this kind of stopgap, but not intended to compete with regular insurance plans. But in 2018, the Trump administration changed the rules and said that short-term plans can now last up to 12 months, and they can be renewed for up to 3 years. So what was this, really short-term stopgap coverage now basically looks like a regular plan, because it can last for nearly a year and it can be renewed. And short-term plans may even be sold on the same ACA marketplaces, so it can be really difficult if you're a consumer to know what plan you're buying. And the problem with short-term plans is that, one, they don't have to follow the ACA rules. So, about 3/4 of them don't offer prescription drug coverage. They don't have to have the pre-existing condition protection, so they can charge you more for your premiums based on having a bleeding disorder, or they can deny you coverage in the first place. They can institute lifetime and annual caps, and they don't have to cap out-of-pocket expenses. So if you have a bleeding disorder, these plans are just, may offer catastrophic coverage, if you're hit by a bus, but they're not going to cover clotting factor or other hemophilia treatments. Most don't offer maternity services, so they're really, really narrow and are inadequate for our needs for sure. But the problem is, because so they're a problem for us, I would just really strongly discourage anyone in our community from ever buying one of these plans. But separately from that, because they offer such narrow coverage, their premiums are really inexpensive. And so they may be attractive to people who are younger or healthier, who are not anticipating having healthcare needs. And so, but the problem is, if everybody who is younger or healthier doesn't have as many healthcare needs, leaves the individual market to buy a short-term plan, then we won't have those people in the marketplace to pool all the risk, and so premiums will go even higher for everybody who stays. So it's really a 1-2 punch that harms our patient community and really anyone with pre-existing conditions. And so that's why we are supporting HR 1010, which is a bill in the House of Representatives, which basically stops the rule that the administration implemented last year from taking effect. So it basically gets rid of this rule. It would not allow plans to last for a year or to be extended. Here on the slide is Congresswoman Kathy Castor from Florida, who is the lead sponsor of the bill. So on the House side, we're hoping that members of Congress will co-sponsor this bill. On the Senate side, there is not yet legislation. There may be before we get to Washington, in which case we'll update you when we're all together that Wednesday evening. But we hope that members of the Senate will also support rescinding the rule because it jeopardizes access to insurance. And, this is where I think you are fair to say, Congressman and Senator so-and-so, again, you said you want to make sure folks with pre-existing conditions have access to affordable comprehensive insurance. This really impedes that, so I hope you'll support the bill. And so then finally, we close all the meetings with a thank you for attention and willingness to learn more about our community. Encourage you, because you'll have spent about half an hour with folks, and so always encourage you to repeat kind of the bottom line. So we're always willing to be a resource. We hope you'll support federal programs that benefit our community with details in the folder. And we hope that you'll support stopping short-term plans to make sure that we have access to good insurance, either by co-sponsoring the bill in the House or supporting the same policy in the Senate. And with that, I will thank all of you for your attention. And I think we will now open it up for questions. So I'll turn back to my colleagues in New York to run the Q&A.
Great, thanks, Joanna. Our first question is, if a military member should wear their uniforms?
So what I would say about that is, if you feel strongly that you want to wear your military uniform, you can, but should you? Not necessarily. What would be more important is that we demonstrate unity visually when we go up on the Hill. So we're really going to encourage everyone to have the red tie. But it is an intriguing question, and what I would say about it is I'm curious as to if that person who has served in the military has a bleeding disorder themselves, or it's a family member, and how to incorporate that into what you share on the Hill. So what I would ask you to do is find either myself or Beth or Marla on Wednesday before the training, and we can sort of talk that through with you. There's another question about the distance between the hotel and your meetings on the Hill. And we can tell you that if you're walking from the hotel to the Senate side of Capitol Hill, it's probably about a 10-minute walk. But if you're walking from the hotel to the House side, where there are obviously more offices and probably more visits, that's maybe about a 15 to 20-minute walk. We would tell you to budget probably about 15 minutes to go between the House and the Senate. Sometimes the security lines to get into the buildings can be very lengthy if there's a lot of folks on the Hill that day.
And I also want to add that sometimes also the Capitol Park, which is in between, is closed, and that's kind of your shortcut. So then the next question is for Beth. Is the attire for Wednesday and Friday the same as Thursday?
No, Thursday is the Hill day when you'll be meeting with the representatives. So we ask you, that's the day that you dress in a more professional manner, and you will be wearing the red tie. Wednesday and Friday are training days, and we don't have a particular dress code for those days.
And then a question about scooters. So if the person didn't rent a scooter, our scooter is going to be available.
No, you would need to include that when you made your reservation.
Okay, great. And the next one is about childcare. And I missed that. The person apparently missed the statement about childcare, and I will happily answer that, is that there is no childcare, but I want you to be prepared. And as a mom, it's a lot. There's a lot of walking. It is a very, very long day. So just be prepared for that. So especially if you have young children who are all excited to go, just be prepared that it is a long day. And lately, there always is a lot of news on Capitol Hill. So there's been a lot of news crews around, so it may be a little bit crowded depending on where and what buildings you're going into.
There's a question here about what sort of ID or anything you need to get into the buildings.
So you don't need an ID to get into any of the legislative office buildings. Joanna, correct me if I'm wrong, but you do need one if you're going to go into the Capitol Visitor Center.
No. If you're going through the CVC, no, you don't need an ID.
You can't not. I recall this though. It just made me remember something. You can carry bottles of water with you past security, but I don't think you can at the Capitol Visitor Center or the Capitol building.
Yeah, that is correct. That you can't bring in water or snacks, or sometimes they throw out your hand lotion too. I will admit I've sometimes snuck in a granola bar that they missed, but sometimes they make you throw it out too. So just if you're packing snacks for the day, and you'll know on your schedule if you're planning to go through the Capitol, either for a coffee in the morning or for a meeting, and so we'll include those notes there just to remind you.
And if you, in fact, have a meeting in, you know, for example, one of the speakers' houses, right? Be prepared that the security for those offices do take a little bit longer. And then, can you bring a stroller to the Hill for a young child? Absolutely. It's absolutely, you can
bring a stroller, but keep in mind you are going to have to go through security and metal detectors, so that would be a little complicated, and you need to budget accordingly for your time. One of the things I think we stressed is you do need to be on time for your meetings. And like we said, we're going to give you a personalized schedule. We're going to go over it. We'll remind you of all of this on that Wednesday. But if you are running late, we encourage you to call in advance and let them know that you're running late, and you'll have the phone number right on your schedule. We'll make it very easy for you.
Also, some of the meeting rooms that you'll be having the meetings with are kind of small. So if you are going to bring a stroller, we would recommend bringing one of the more lightweight folding ones and not one of the big executive ones.
And I think it's also fair to say, like, you know, just be prepared. Be prepared for sort of anything with respect to that. And then the next question is it okay to take photos or videos in sessions?
Some people do have a no video requirement. I've actually seen that in some of the offices. We encourage everybody to ask permission before doing anything photograph or video. Like we said, most representatives will be happy to accommodate a photo. I'm not sure about video. They might be a little bit more reluctant there. Some aides don't like to be photographed. And then also, if you're going to use the photo on social media, I would say, you know, request permission to say that we're going to be I want to post this on Instagram and tag you and everything. Is that okay? And, you know, they usually will be, but asking permission is really the most important and polite thing to do.
I have a question about talking about other issues that are important to me and whether or not that's a good idea, or do I have to stay with the talking points provided?
So we will encourage you to stick to the talking points that we have provided. This is your opportunity to represent the bleeding disorders community and NHF as a participant at Washington Days. However, I will say this, one of the important things about any legislative visit is you're there to establish a relationship with someone, either the member or a staff member. So if you are successful in establishing a relationship and subsequently you want to contact them about other issues that are important to you and your family, that is entirely appropriate. But for the purposes of what we will be sharing during Washington Days, you need to stick to the talking points.
And as a follow-up question to that, what happens if someone on my team goes and talks about something which is not relevant to what we're talking about?
This is where we'll have to challenge one another and hold one another accountable and encourage what I would call sort of self-policing among your team, where if someone does go offhand, you need to sort of rein them in. And, you know, keep in mind too, you're there as a team and you do get tired. I remember being with one family and a mother just got really emotional telling a story, and it was important for the other team members to jump in and give her a little bit of time to catch her breath and compose herself. So you do have to work with one another. And also, after you have your first meeting or two, feel free to check in with your team and say, hey, how did that feel for you? Do you think maybe we should switch around the order of who's going to say what? You know, you're there as a team, so help one another out.
And I will add,
I'll just add, sorry. that folks who participate in Washington Days sign something that we call the Code of Conduct, which kind of says that you'll keep everything confidential that you hear. You know, if many of us wear different hats, and so that people will keep everything confidential as people are telling their personal stories. And there's also a thing that you'll sign saying that you will kind of stick to the issues that we're talking about. There have been people who have not been able to do that. And so if you have someone on your team who persists in bringing up something that they're not supposed to, I would encourage you to share that with a member of NHF staff. There have been people who have been asked to leave Washington Days or to not come back in future years. So we do take pretty seriously the idea that we are all there together as part of one event to share, you know, kind of one set of issues, and that folks who, if you're not able to do that, that may jeopardize your ability to participate in the event.
We have another question. Somebody asks, I will be coming in late on Wednesday. I think after registration is closed. So how would they register?
Well, registration will also be open on Thursday morning before the briefing starts. But what is important, not necessarily just about picking up your badge, but as a new person, because you're on the webinar, it is important to check in with your team. And you will know who's on your team, and it is important to look for them because the teams do travel often as a group to meet up to their first appointment. So look for the signs on the tables for your state and your team.
And you'll know who your team is. Sorry, this is Joanna, just to pipe up one last time, I promise. You'll know who your team is because I will send everyone their tentative schedule the weekend before Washington Days, and so you'll have everybody's email there, and you'll know, okay, I'm coming from Minnesota. Who are the other folks from Minnesota who are on my team? And I'll also encourage you in that email to let me know if you are going to be late, because we want to make sure that we have the people who are the constituents for each office. And so if you don't tell us you're going to be late and then you're not there for training or for breakfast, we're going to assume that you didn't show, and so we may cancel meetings. And so please do let us know if you have travel issues or otherwise miss the training on Wednesday.
And with that, I'd like to thank our speakers, and we look forward to having you in DC in a couple of weeks. And any final thoughts?
Thank you, everyone, for your participation today. Keep in mind that this will be available online, so if anyone that you know was unable to attend but curious as to the information that we shared, feel free to encourage them to check it out.
Thanks, everyone.
Thanks.